Hello, we are from Group 1 and we will be presenting about the topic MERS-CoV. Middle East Respiratory Syndrome-related coronavirus is a species of coronavirus which infects humans, bats, and camels. The infecting virus is an envelope-positive sense single-stranded RNA virus. Coronaviruses are a large family of viruses that can cause diseases ranging from the common cold to severe acute respiratory syndrome, which is SARS. These viruses are zoonotic, meaning that they commonly infect animals and can transfer to humans.
MERS is a zoonotic virus, which means it is a virus that is transmitted between animals and people. Studies have shown that humans are infected through direct or indirect contact with infected dromedary camels. MERS has been identified in dromedaries in several countries in the Middle East, Africa, and South Asia. The origins of the virus are not fully understood, but according to the analysis of different virus genomes, it is believed that it may have originated in bats and was transmitted to camels sometime in the distant past.
Cases of Middle East respiratory syndrome have been reported from 27 countries, including Austria, Algeria, Bahrain, China, Egypt, France, Greece, Germany, Italy, Iran, Jordan, Kuwait, Lebanon, Malaysia, Netherlands, Oman, Philippines, Qatar, Republic of Korea, Saudi Arabia, Turkey, Tunisia, Thailand, United Arab Emirates, United Kingdom, United States, and Yemen since 2012. According to WHO, at the end of January 2020, a total of 2,519 laboratory-confirmed cases of Middle East respiratory syndrome, including 866 deaths, were reported globally. This brings the case fatality rate to 34.3%. Majority of these cases, 2,121 cases, were reported from Saudi Arabia, including 788 associated deaths. On 17 April 2014, the Ministry of Health of Malaysia reported the first laboratory-confirmed case of infection with MERS-CoV in Malaysia. The patient is a 54-year-old man with predisposing health conditions. He traveled to Jeddah, Saudi Arabia, with a pilgrimage group of 18 people. The patient had a history of visiting a camel farm on 26 March, during which he consumed camel's milk. On 2 January 2018, a second case of laboratory-confirmed MERS-CoV was reported in Malaysia. The case involves a 55-year-old male who traveled as a member of a pilgrimage group to Saudi Arabia. Patient recorded a history of exposure to dromedary camels while visiting a camel farm in Riyadh. He had direct contact with a camel and drank unpasteurized camel milk. As of 5 January 2018, no further cases have been identified in Malaysia.
Transmission of MERS can be divided into two, which is animals to humans and humans to humans transmission. For animals to humans transmission, it is believed that humans can be infected through direct and indirect contact with dromedary camels. However, the type of human exposures that result in infection remains to be uncertain. For humans to humans transmission, the virus does not appear to pass easily from person to person unless there is close contact, such as providing clinical care to an infected patient. For example, family members, patients, and healthcare workers. Undetermined droplet and direct contact, probably large droplet transmission, is suspected as the most likely route.
To diagnose MERS, a doctor will perform a physical examination and check for fever and swollen glands. Then, the doctor will also listen to the lungs of the patient with a stethoscope. Build-up of fluid in the lungs can be seen with a chest X-ray, CT scan, or magnetic resonance imaging, which is MRI scan. The doctor will send a sample of sputum, phlegm, to a laboratory to confirm the diagnosis by identifying the exact strain of virus that may be causing the patient's symptoms. Detecting the virus in respiratory tract samples remains the gold standard in diagnosing MERS-CoV infections. Several samples can be obtained from the respiratory system that can be used for diagnosing MERS-CoV infection. This includes tracheal aspirates, nasopharyngeal swabs, bronchoalveolar lavage, and sputum. RT-PCR remains the mainstay diagnosis for MERS-CoV infection.
Clinical signs in humans. The clinical signs of MERS-CoV infection ranges from asymptomatic or mild respiratory signs to severe acute respiratory disease and death. Most people confirmed to be infected with MERS-CoV have symptoms such as fever, cough, and shortness of breath. Pneumonia is also one of the common findings, but it is not always present. Cases with gastrointestinal symptoms like diarrhea, nausea, and vomiting have also been reported. According to CDC, the symptoms of people infected with MERS-CoV usually start to appear 5 to 6 days after the person is exposed to the virus, but it ranges from 2 to 14 days. The virus causes more severe effects in the elderly, people with weak immune systems, and those with pre-existing conditions such as diabetes, cancer, chronic lung cancer, chronic heart disease, and chronic kidney disease.
Treatment of MERS. As of 2020, there is no specific treatment against MERS. According to CDC, individuals with MERS, the clinical management is mainly symptomatic and supportive treatment on vital organ function, support including respiratory, and prevention of secondary infection. In case of acute respiratory failure, the use of extracorporeal membrane oxygenation, or ECMO, able to provide an adequate amount of gas exchange. When patients are connected to an ECMO, blood flow through turbine to an artificial lung in the machine that adds oxygen and take out carbon dioxide. Several non-specific antiviral drugs, such as combination treatment, ribavirin, and interferon, improve clinical outcome in MERS. Ribavirin, for example, is a potent nucleoside analog that has been used with varying measures of success against a range of RNA viruses.
As we all know that MERS-CoV is a zoonotic virus, one of the prevention measures that can be done is by avoid direct contact with the camels, especially with his nasal discharge, urine, and feces. Also, we can prevent it by avoid consume undercooked meat and raw milk. Infected camel will shed the virus into their milk and meat. MERS-CoV also can be transmitted human to human. Having social distancing, at least 2 meters, can reduce the transmission of the virus. Also, we should wash our hands with soap and water frequently to avoid self-contamination by touching nose, mouth, or eyes with dirty hands. Other than that, PPE such as face masks and gowns can be worn, especially for health workers and patients. The public also advised to wear a face mask to protect themselves. Furthermore, we also have to quarantine ourselves if you are having a direct contact with infected people or just back from the red zone area.
MERS infection is a potentially fatal disease that can be transmitted across countries. Governments in countries with a high rate of MERS infection are urged to develop and implement guidelines to minimize the spread of infection. It is also important to raise awareness among travelers to regions affected by MERS about the signs and symptoms of the disease and to urge individuals to report any of these signs and symptoms so as to receive proper and timely care.
Run.